Welcome back to our medical channel, your trusted source for medical knowledge. Today we're diving into the world of fibromyalgia, a complex condition characterized by widespread pain, fatigue, and more. Have you ever heard about fibromyalgia, or do you know someone who suffers from it? Fibromyalgia is a chronic condition that's often misunderstood. It's characterized by widespread pain in the muscles and bones, areas of tenderness, and general fatigue. But unlike what many people may think, it's not an inflammation or damage to the joints, muscles, or other tissues. Rather, it's a pain processing disorder. Imagine the brain's pain receptors behaving like an oversensitive alarm system, reacting to even the slightest triggers. This is what happens in fibromyalgia. The pain receptors in the brain seem to be unusually sensitive or overreactive, leading to the perception of pain even when there's no apparent cause. It's a complex condition, and the exact causes remain unclear, but that doesn't mean it cannot be managed. Understanding fibromyalgia begins with recognizing its symptoms. The symptoms of fibromyalgia can vary from person to person and are often intermittent. The most common symptoms are chronic pain, fatigue, and cognitive difficulties. The pain is typically widespread and is often described as a constant dull ache that has lasted for at least 3 months. Fatigue is another common symptom, with individuals often waking up tired, even after sleeping for long periods. This is because sleep is frequently disrupted by pain, and many individuals with fibromyalgia have other sleep disorders like restless leg syndrome and sleep apnea. Cognitive difficulties, often referred to as fibrofog, can impair the ability to focus, concentrate, and perform mental tasks. Other possible symptoms include depression, anxiety, headaches, irritable bowel syndrome, numbness or tingling in the hands and feet, and sensitivity to pain, cold, or loud noises. While symptoms can be varied, the cause of fibromyalgia remains a mystery. The exact cause of fibromyalgia remains unknown, but several factors are believed to play a role. Genetics is one of these factors. It's been observed that fibromyalgia tends to run in families, suggesting that genetic mutations may have a hand in developing the condition. Another factor is infections. Certain illnesses seem to trigger or even aggravate fibromyalgia. Interestingly, both physical and emotional traumas have been linked to the onset of this condition. A physical trauma such as a car accident can sometimes set it off. Similarly, psychological stress, often resultant from significant emotional events, may precipitate the condition. It's important to understand, though, that these are not definitive causes but possible triggers or contributing factors. Each person's experience with fibromyalgia is unique, and what triggers one person's condition may not trigger another's. Despite the unclear cause, diagnosing fibromyalgia involves a specific process. Diagnosing fibromyalgia can be a challenging process, as there is no specific test for the condition. Doctors often have to take a two-pronged approach. The first step is typically ruling out other diseases. Conditions such as rheumatoid arthritis or lupus can mimic fibromyalgia, leading to misdiagnosis. To avoid this, a series of tests and examinations are conducted to ensure these aren't the root cause of the symptoms. The second step is assessing symptom history. Doctors look for a history of widespread pain that has lasted for more than 3 months. Alongside this, they assess the presence of other typical fibromyalgia symptoms, like fatigue, sleep disturbance, and cognitive issues. It's a process of piecing together a puzzle, and when the pieces fit, a diagnosis of fibromyalgia is made. Remember, a diagnosis isn't the end of the journey. While a diagnosis can bring relief, managing fibromyalgia is the next step. Managing fibromyalgia can definitely be a challenge, but remember, with the right strategies, you can lead a fulfilling and active life. If you're finding this content helpful, don't forget to like, share, and subscribe to our channel. Now, let's dive into the treatment options for fibromyalgia and explore how you can find relief. While there is no cure for fibromyalgia, a variety of treatments can help manage symptoms. For many, medications play a key role in symptom management. Pain relievers, antidepressants, and anti-seizure drugs often help curb the pain and fatigue associated with fibromyalgia. Physical therapy is another important element of treatment. A skilled physical therapist can design an exercise program to improve strength, flexibility, and stamina. Regular exercise can also boost mood and facilitate better sleep. Incorporating lifestyle changes is also beneficial. Regular exercise, maintaining good sleep habits, and practicing stress management techniques can all help alleviate symptoms. Psychological therapy, particularly cognitive behavioral therapy, has shown efficacy in managing the emotional aspects of the disease. This form of therapy can strengthen coping strategies, helping patients better manage their condition. As we wrap up our discussion on fibromyalgia, remember that while it is a complex condition, many find ways to manage their symptoms and lead fulfilling lives. It's about finding what works best for you and making those necessary adjustments to enhance your quality of life. Don't forget to like, share, and subscribe for more helpful content. Stay healthy and take care.